you need that, or you are for some reason an LVAD patient and you need your batteries recharged on your machine. We are accommodating people. We are allowing people special rooms to hook up and get oxygen. We are allowing them to get batteries charged and supplies for that. So if there is any concern for that, maybe even calling the local hospitals before you leave your house and seeing if that's something that they're available to do for you.
Okay, there's probably other resources. You mentioned your primary care doctor. If you're part of a managed care organization, you may have a advice nurse line that you can call. And certainly, if you're the kind of folks that are at home on oxygen, having electricity-dependent medical equipment, if you have a caseworker, if you have a case manager, if you have a nurse, a caseworker, perhaps giving them a call and letting them know what's happening now, they would also be a good resource.
On top of that, I just want people to know that the Red Cross is working very hard to set up hubs for people around the Houston area for people to get things that maybe not emergent conditions, but dialysis and medications. They are working to do that. So also look online and call your local officials and see if anyone is available to help out with certain things like that.
I know you're tired. You want to get to bed. You're home now for the first time. I'm reading about this incredible Texas spirit on the news, how folks are helping each other out and they're being good neighbors and they're not misbehaving despite this natural disaster. Any people you want to call out for the special effort that they've done to help you in your work at the hospital or get you home safely? Who would you like to thank today, Dr. Bede?
Well, I think I want to thank everyone over at the hospital I was working there, still nurses that have been there for several days, and they're working hard to make sure that we treat those people who are in need the most. Thank you to the other doctors who have shown up in the storms around the Houston area to do what we always do in the emergency room, which is take care of people when they need it the most. And, of course, my husband, Joseph, who drove me to and from work during this storm. So, yes, everyone is working hard, and there's a real sense of community that's going on out there. And, again, our EMS workers who've been working tirelessly to help those who are really in a crunch and need the most help out there.
Well, I'm glad that you are okay, and I'm glad you had a little bit of time in between shifts to talk to us about what's happening down in Houston. Thanks for coming on the program, Mallory.
No problem, anytime.
Until next time, my friends, not only stay healthy, but stay dry.
Be sure and subscribe to our podcast on iTunes and more details at grumpyolddoc.com.